Okay, hi, it's Dr. Buford. Here's Dr. Moore. We're just getting started on your left shoulder. Your shoulder is very loose to the front once we examined you under anesthesia, so we're expecting to find exactly what we talked about, just a little bit of that real loose appearing joint, and that's already what we can tell you have. This is the back. The capsule's intact up above. We wanted to check that. And here's the posterior labrum. We're going to be tightening up back here. Rotator cuff is okay. And then as we look down the front, you can see a little bit of fraying in the labrum. And there's a little bit of an entry to the anterior labrum there. So we're going to get to work starting in the back. We'll go off on the video just for a minute. Pause, please. Okay, so now we're looking from the front to the back. First of all, there's your Bankart injury in the front. There's the damage to the front of the shoulder. So we're going to be dealing with that after we work in the back. And then as we look towards the back here, we're now going to use a rasp just to roughen up the capsule. So there you can see us using it here. You don't really have a big Hill-Sachs lesion, so that's good. That's an injury to the ball that we talked about in the office when the ball gets kind of dented in from the dislocation. Is the green light on the microphone? On the side?
Yes, sir.
Okay, good. So now, after roughening up the capsule a little bit, we're going to place a stitch. The labrum looks okay back here. This is the labrum right underneath my rasp, and that looks solid. So we're going to go ahead and take our turn to the right suture hook. Here it is here. It's loaded with a black wire called the super shuttle. There you can see it coming out of the tip. So we're going to start right down here. And you can see how we go into the capsule. Through like that. There's our first pass. We'll go ahead and feed that through. Look at the camera, please. Give me a grasper, please. Just give me all graspers today. Hold the cannula down, please. Just pull it all the way. And so there you can see our first stitch. Go ahead and pull that through. Pull that cannula down, please. And let me see a suture. Okay, so now we're going to pull this white stitch back through. There you can see the cannula, you can see the stitch, and then it comes through the yellow cannula in the back. Grasp it. So, you know. Okay, and now we'll take a crochet hook. See if we can pass this to ourselves like that. See what we're doing there. That cannula over on the screen. We can see it. Push it in. Push the cannula. Thanks. Okay, so now we're ready to make another pass with our suture hook. So here we are getting ready. And we're going to make our stitch. stitch right about here. I've got it up here. And you can see we're going to come down through the labrum there, feed the relay through a bunch. Hold it, camera, just for a second. There's things. Okay, so now we'll go ahead and load that stitch through again. We'll show you some more in just a minute, possibly. Okay, here we are pulling that second pass through. And now we'll look and make sure there's no twist in the suture. Tight. See, there's a little twist there. So what we'll do is we'll pull a little bit tighter. Then we're going to reach in and grab this stitch out this way. And so now what that does for us is it gives us this nice cross stitch, which is a very strong stitch. That will secure this posterior capsule. So now we're going to tie it. We'll get this tied and show you some more in a little bit. Pause, please. Okay, here we are clipping the suture tail. So that's the first stitch in the back. You can see it right there. Okay, I'm happy with that. So now we're going to go ahead and switch things around again. We're going to put the gray cannula in the back of the shoulder. So we're going to take a switching stick in like this. Go ahead and pull the yellow back. And then we'll take a smaller cannula, or smaller switching stick, and put that in the front. Okay, pause please. And here anteriorly, you can see this Bankart injury. See how this pulls away from the bone? The bone is here on the left, and the labrum's on the right side of this instrument. And that's not normal. So the first step is actually to free this up a little bit, which is what we're doing here. There you can see that released it. And now we have that pretty well freed up. Okay. And that little bit of bleeding is normal once we release some of the scar tissue. Okay, so that's pretty good. So we'll use the rasp part of this, these sharp points, and we'll just gently roughen up the anterior capsule. And the structure is down here. Okay, and so now we're going to place some implants in the front, which is something we didn't show you on the back. So Kendall, you have to come up there and help. So here's our curved guide. pull back in the humeral head. So let Kim open a little bit. That position looks pretty good right there. Next we'll put the implant down. So there's the implant. Now we'll go ahead and take a tug because that's what seats the implant. And once we do that, that feels very solid. Here you go. Okay. Let's keep this straight. Okay, so very good. Now we're going to take one of these sutures out the back. Very cannula in like that, just hold it right there, pull back a little bit. Except we want this one. And now we'll take a turn to the left, suture hook. So there's our hook coming in. Start right here, so rotate back. Try and get through the capsule down here. We'll get this done, show you some more in a little bit. Okay, here we are feeding the grasper, the relay through. Just grab it here. Okay, we'll show you some more in a minute. Pause, please. Okay, so we've done our first stitch. It's a little bit hard to see. I don't want to take away any extra tissue if I can avoid it, but you can see our first stitch there. That looks good. We've got two more to place. See, all this is still loose here. And once we replace that, hopefully we'll be able to bring this tissue down to make a nice bumper to look something like that. So now we're going to take our guide once again. Down. And we'll go, let me give you the, you can probably go the arm down. Let me give you the scope, Dr. Moore. We're going to get right about here. So there we are. We'll pull back, make sure it's seated. And that feels very solid. We'll go ahead and take out one of the sutures here on the left, like that. And then, like we showed you before, we're going to take a suture hook, turn to the left, grasp it up more. Here's the hook. Start here. Just sneaking through underneath right here. There it is. So we'll go ahead and feed that through. Pause, please. Okay, so we finished our second suture. There it is right there. So now we've got one more. This is a different guide. This is the straight guide. Same suture anchor, but just a different guide. We're going to put this right about here. Hold this scope, please. So there's the next set of sutures we'll pull back. And that feels very solid. And we'll keep working and show you some more in a minute. Pause, please. Okay, we're just fine-tuning things and finishing up here. I'm real happy with the way things look. Here you can see down the front of the shoulder. And it's actually hard to see down the front compared to when we started, and that's good. We've got 3 anchors in, holding things up against the bone, and we've got that 1 stitch in the back holding together the posterior aspect of the ligament. So you can see it just down at the tip of the instrument. See right there. So we've got 1 stitch down here without an anchor, and then 3 anchors in the front. So I'm very happy with that. We're going to finish up here, get you back to the recovery room shortly. Good luck to you now. Bye-bye.